Welcome back. A large order of ventilators that were being held up in Turkey. That order is now heading to Spain, we understand. Turkey had put limits on exports of medical equipment about a month ago when the coronavirus outbreak was getting worse there. And all this comes as the COVID-19 death rate in Spain continues to slow down. Now, it's important to note that though the death rate is slowing down, the number of daily deaths is still very high. Just in the past 24 hours, 637 people have lost their lives. For people losing loved ones, funerals have taken on a decidedly unfamiliar tone, and that is adding to the anguish. Scott McLean reports.
Every 15 minutes or so, a hearse pulls up in front of the crematorium at Madrid's La Almudena cemetery. Father Eduard, a Catholic priest, comes out to greet no more than 5 grieving family members who keep their distance. Hugs and kisses are an uncommon sight. The blessings and prayers last barely 5 minutes. The sealed casket is doused with holy water and taken away on a gurney. No eulogies, no visitation, no public burial. There's hardly even time for a goodbye. These are the rules under Spain's coronavirus state of emergency. A strange scene even for one of the largest cemeteries in Western Europe. It's been there through wars, famine, and the Spanish flu. I can't express the sadness that people are carrying, not only because their loved one has died, but because the system is so overwhelmed that they may have been taken to the ice rink for several days before they're brought here, he says. In Madrid, the epicenter of Spain's pandemic, 2 ice rinks are now being used as temporary morgues. Cemeteries say they're burying 2 or 3 times as many bodies as usual.
We cannot do things by the book because unfortunately, there's no book.
Felix Poveda contracted the virus at a family gathering weeks ago. His brother and mom got it too. All were eventually hospitalized. His mother, who was 77, died in the hospital. She was not given a ventilator.
I don't know how to feel. I am alone here. My brother and sister, they couldn't come. My wife is not coming. Grandsons and granddaughters are not coming. Just me.
It's not the kind of final send-off anyone would hope for. Felix plans to have a funeral for his mother when the crisis is over. He's just not sure when that will be.
All right, and Scott McLean joins me now live from Madrid, Spain, with more. Just so many individual tragic stories, one after the other. Not just the anguish, Scott, obviously, of losing a loved one, but not being able to say goodbye properly. Now, the number of deaths still very high, as I mentioned before your report, but the fact is that every day that number is getting smaller. That has to be encouraging for officials and a sign that this lockdown is producing some results.
You're right, Hala. Under any other circumstances, you would expect that more than 600 deaths in a single day would be a national tragedy. Here, though, it is a sign of progress, a sign that these harsh, strict restrictions that Spaniards had been under for 3+ weeks are actually working. The increase in new active cases has decreased substantially. In fact, today's number is the lowest that it's been in 3 weeks. Recoveries and deaths are starting to take some of the strain off of hospitals, but as you saw, now some of that is being felt by cemeteries. Spain's stay-at-home orders, we know, Hala, is likely to be extended until April 26th, and even after that, restrictions will only be lifted gradually. The hope is that they can issue enough tests. They're distributing 1 million across the country beginning today. They're hoping that that will help further slow the spread of this virus. They're particularly targeting nursing homes and hospitals. Healthcare workers have been particularly hit. Almost 20,000 healthcare workers infected. That is about 1 in every 7 confirmed cases in this country.
Scott McLean live in Madrid. Thanks very much.